Hi, everybody. For week 11, I saw a patient, MM, who is an 18-year-old female, and she presented to the my emergency room for some bradycardia as well as some hypokalemia. So originally, she presented to her pediatrician for just a routine checkup, and they found her to be bradycardic to 38 beats per minute, and then her her potassium was 3.0. So we went to the emergency room and I was able to assess her. And in talking with her, she explains that she's been struggling with anorexia for a very long time since the eighth grade. And it started to worsen in intensity in 2022 when she started developing some binge purging behaviors. And that was because of a lot of like psychological, psychosocial stressors that were going on at the time. And her maximum weight that she's ever been able to obtain has been 130 pounds, and that was in the spring of 2021. And unfortunately, it slowly deteriorated to her current weight of 96 pounds. And she attributes that weight loss to stress. So, her amount of daily self induced vomiting can range from 3 to 5 times a day, 5 times a day being like the more stressful day, but at least 3 times every day. And that started to escalate more in the fall. Also, too, she feels like she needs to vomit more when she eats foods that she considers bad foods, and bad foods for her would be desserts, granola bars, breads, things of that nature. Unfortunately, too, she does have binging episodes where she eats to the point of involuntary throwing up. So, a normal binging episode for her looks like having a lot of desserts, a lot of breads, and like granola bars, things that she has considered bad foods, and then throwing up after that. So, a typical day for eating for her would be for breakfast she would have yogurt and a coffee. For lunch she'll have like a protein bowl. They are frozen meals, so the nutritional value is not as high as like an actually fresh prepared bowl, but they include grains and vegetables. And then for a snack she has a protein bar and then a protein shake, and for dinner she has meat and milk and some vegetables. So upon psychiatric review of systems, she is endorsing some symptoms of depression, such as a decreased interest in doing enjoyable activities like soccer, and she also describes like a depressed mood. She does deny any SI, and she rates her mood as a 4 over the past 2 weeks and a 6 out of 10 currently. She does say though that her mood has increased a little bit because she is looking forward to her vacation. She's going to Cancun for spring break with her family, so she's looking forward to that. Uh, She also occasionally experiences some anxiety attacks, but the anxiety is more related to her food, like thoughts around food and things of that nature. She denies any auditory or visual hallucinations, even any thoughts of paranoia or delusional thinking. She sleeps inconsistently. She describes about 7 hours per night. She does have some outpatient provider and treatment with therapy, so that was a positive, and she finds her therapy helpful. So for her diagnosis, Axis 1 is anorexia nervosa binge purging type. Axis 2 is deferred. Axis 3 is bradycardia and hypokalemia in the setting of anorexia nervosa binge purge type. And Axis 4 is losing friends. She lost a lot of friends just recently. Also, her boyfriend moved away to college, and also the stress of applying to college herself. So, I found a very interesting article that talks about microbiome deficiencies for anorexia nervosa patients. And this article says that the results of the studies for anorexia nervosa, binge purge, and restrictive type showed that the majority of the patients had at least one micronutrient deficiency. Zinc was the most significant trace element deficiency in 64.3%, whereas 37%, 27% of the patients exhibit carpeted, copper, and or psyllium deficiency, respectively. And I just think that's important because we have to see our patients in a holistic realm and just from a holistic point of view, and not just only see them for prescribing medications, but also like are they deficient in nutrition, and what other things can we supplement to help give them the best chance of recovery. And the plan for her, she's definitely going to be admitted to the University of Michigan for the refeeding protocol, and also are going to support her psychiatrically with PRN medications of hydroxyzine 12.5 milligrams and Zyprexa 1.25 milligrams PRN for anxiety and panic attacks. All right, thank you. Have a good day.